Hello, everyone. My name is Leesa Lin. I would like to thank you for joining the presentation. Today, I'll be speaking on vaccine confidence in Asia. There is growing evidence of vaccine delays or refusals due to a lack of confidence in the importance, safety, or effectiveness of vaccines, along with persisting access issues. Below are highlighted findings from a recent global mapping study of vaccine confidence using the Vaccine Confidence Index in a sample of Asian countries between 2015 and 2019, which described the context leading up to the current COVID-19 vaccination. In the Philippines, vaccine confidence had dropped significantly by more than 55% between 2015 to 2018 over well-documented fears around the dengue vaccine in 2017. Such loss of vaccine confidence appears to have also affected uptake of routine vaccination. Based on recent surveys, however, between March and May 2021, there is a considerable increase in vaccine confidence among Filipinos to nearly 75%, about 1 month since the government rolled out the COVID vaccines. In Malaysia, as the figure shows, public confidence in vaccination was high and stable, fluctuating between 65 to 75% before a continuous descending trend since spring 2019. A recent survey on Malaysian COVID-19 vaccine acceptance showed that the overall acceptance rate was high, around 85%, with the lowest rates among the elderly. Hesitancy was caused by concerns regarding side effects, safety, lack of information, effectiveness, and religious and cultural factors related to COVID-19 vaccines. The internet and social media have been identified to be the main sources of vaccination information in Malaysia, where misinformation has been identified as influencing vaccine hesitancy. In Vietnam, between 2015 and 2019, public confidence in the safety of vaccines fluctuated at a low level around 35%. Public confidence in vaccine importance and effectiveness had also declined significantly starting in mid-2018. Studies have found that media representation of vaccine side effects has had a negative impact on utilization of vaccination services in the country. A survey conducted in April 2021 among health science students reported a high 77.7% of participants intended to receive a COVID-19 vaccination when it becomes available. Fiji, which is a small Pacific island nation with a population of around 900,000, is considered the most capable country in the region to handle an outbreak. Back in 2008, Fiji implemented a successful nationwide HPV campaign targeting all girls aged 9 to 12 years through the existing school-based immunization program. Public confidence in vaccine safety and importance declined between 2015 and 2018, as the figures showed. Meanwhile, the percentage of the respondents who strongly agree that vaccines are effective fluctuated around 60% throughout the study period. During the COVID-19 pandemic, social media such as Facebook, Viber, and Instagram were found to be the main source of COVID-19 vaccine-related information. However, fake news and misinformation about the COVID-19 epidemic and vaccines on these platforms have impeded the rollout process. In China, we saw a steady increase in the percentages of Chinese respondents perceiving vaccines to be safe, important, and effective since 2015 until the Chengchen vaccine incident, which occurred in 2018. The incident caused vaccine crisis and panic among Chinese parents, which had triggered a nationwide reform of vaccination supervision and management. There is a series of risk communication and community engagement responses from the local public health agencies. In the end, The Chinese public confidence in vaccination suffered temporarily, but bounced back after quickly and has not dented routine childhood immunization rates. In a nationwide cross-sectional survey of around 3,600 adults across China, which conducted in May 2020, showed that 95% of the respondents were confident or completely confident in the domestically made COVID-19 vaccines. In conclusion, we found vaccine confidence fluctuates. Evidence suggested vaccination decision-making in this region were influenced by various factors before and during COVID. Like the rest of the world, digital platforms have been identified to be the main source of fake news and misinformation about COVID-19 epidemic and vaccination for many Asian countries, such as South Korea, Malaysia, and Fiji. Therefore, regular monitoring of public sentiment and local immunization rates at the national and subnational levels can identify populations with declining confidence and acceptance, and can also inform the tiny development of context-tailored interventions. For example, evidence have shown that more communication from healthcare professionals and providing timely evidence on vaccine safety are critical drivers of vaccine confidence. Thank you, and I will see you at the panel.